If you've been watching the news lately, you've probably heard that drug prices are going down. Medicare is negotiating prices directly with pharmaceutical companies for the first time. Costs at the pharmacy are changing. And if you're approaching Medicare age, you might be wondering, do I even need Part D anymore? That's exactly what this video is about. I'm going to tell you what's actually happening, what it means for you, and whether Part D still makes sense. Spoiler alert, yes, you still need it. But let me explain why, because the answer is more nuanced than a yes or no. I'm Robin Dall, independent Medicare broker and educator at RobinsWisdom. No call centers, no 1-800 numbers, just straight answers. Let's get into it. Let's start with what's actually changed, because there's a lot of noise around this and not all of it is accurate. The Inflation Reduction Act, passed in 2022, gave Medicare the ability to negotiate drug prices directly with pharmaceutical manufacturers for the first time in history. Before this law, Medicare was specifically prohibited from negotiating prices. That's changed. In 2026, the first round of negotiated prices take effect for 10 high-cost medications. These are Eliquis, Jardiance, Xarelto, Januvia, Farxiga, Entresto, Enbrel, Imbruvica, Stelara, and Fiasp. These drugs treat conditions including blood clots, diabetes, heart failure, cancer, autoimmune diseases, and chronic kidney disease. The negotiated prices represent discounts ranging from nearly 40 to nearly 80% off the 2023 list prices. The estimated savings to Medicare beneficiaries in out-of-pocket costs is $1.5 billion. The program is ongoing. A second round of 15 drugs will have negotiated prices effective in 2027. A third round is currently being negotiated for 2028. That said, recent legislation has limited some aspects of the program's expansion, so the pace of future negotiations may be slower than originally projected. The bottom line? This is real progress, and it's continuing, but it's targeted and gradual, not a sweeping fix for all drug costs. Here's the thing, though. Lower drug prices, even significantly lower drug prices, don't eliminate the need for Part D. Here's why. The penalty doesn't go away. The late enrollment penalty for skipping Part D when you should have enrolled is still fully in effect. If you go without creditable drug coverage when you're first eligible, you will owe a permanent surcharge on your premium, regardless of what drug prices are doing. That penalty is calculated on the national base beneficiary premium, not the price of any individual medication. Not all drugs are affected. The price negotiations cover a specific and limited list of medications. The first round covers 10 drugs. Even as the program expands, the vast majority of medications won't be affected by negotiated pricing for years, if ever. If your medications aren't on the list, your costs aren't directly changing because of this legislation. You still need coverage for the unexpected. Part D isn't just about what you take today. It's protection for what you might need next year or the year after. A new diagnosis, a new prescription. Drug prices on your specific medications could change. Having Part D in place means you're covered when something changes. One of the biggest improvements to Part D in recent years has nothing to do with drug price negotiations. And it's the reason Part D is actually better now than it's ever been. Starting in 2025, there is a $2,000 annual out-of-pocket cap on covered prescription drug costs. In 2026, that cap is $2,100. Once you hit that cap, your covered medications are free for the rest of the year. Before this change, there was no cap. People on expensive specialty medications could pay tens of thousands of dollars out of pocket in a single year. Now, there's a ceiling. The combination of negotiated prices and the out-of-pocket cap means that for people on high-cost medications, 2026 is actually the most protected they've ever been under Medicare. But, and this is important, both of those protections only apply to drugs that are on your Part D plan's formulary. If you don't have a Part D plan, neither benefit applies to you. If you're wondering whether your specific medications are on the negotiated price list, here's how to find out. The 10 drugs with negotiated prices taking effect in 2026 are Eliquis, Jardiance, Xarelto, Januvia, Farxiga, Entresto, Enbrel, Imbruvica, Stelara, and Fiasp. If you or someone you know takes any of those medications, the out-of-pocket costs under Part D will be meaningfully lower in 2026. But here's the practical piece. Even if your medication is on the negotiated list, you still need a Part D plan to benefit from the negotiated pricing. The lower prices flow through the Part D system. They don't apply to people without coverage. And if your medications aren't on the list yet, use the Plan Finder tool at Medicare.gov to compare Part D plans based on your actual prescriptions. Enter your specific drugs, dosage, and how often you take them. The tool will show you the estimated total annual cost for each plan in your area, premium, deductible, and expected copays combined. That's the number to compare. So do you still need Part D? Yes. Here's the short version of why. The late enrollment penalty is permanent and unforgiving. Skipping Part D to save on a monthly premium is one of the costliest mistakes people make when entering Medicare. Lower drug prices are real and significant, but they apply to a limited list of medications and they flow through your Part D plan. Without coverage, you don't get the benefit. The $2,100 out-of-pocket cap only protects you if you have a plan. It's one of the most valuable protections Medicare has ever offered, but only if you're enrolled. What you should do right now, whether you're approaching Medicare or already enrolled, 1, make sure you have a Part D plan, even a low-cost one. 2, if your medications are on the negotiated list, compare plans to make sure yours covers them at the best tier. 3, run your specific medications through the Plan Finder at Medicare.gov every fall during annual enrollment. Plans change, prices change, and what was right last year may not be right this year. The drug price landscape is changing in genuinely meaningful ways, but the fundamentals of Part D haven't changed. You need coverage, the penalty is real, and the protections that come with being enrolled are better now than they've ever been. So there it is. Drug prices are going down for certain medications, and that's real and meaningful progress. But it doesn't replace the need for Part D. It makes having Part D more valuable. The next video in this series covers something completely different: the legal documents every person approaching 65 should have in place. Power of attorney, healthcare directives, and why getting these right matters more than most people realize. That one's up next. And if you have questions about your specific Part D coverage or your plan options for 2026, head to RobinsWisdom.com and request a free Medicare review. No call centers, no 1-800 numbers. Just Robin Dall, Medicare educator and commissioned remote online notary. Here to make 65 feel a lot less overwhelming. I'll see you in the next one.